New patients coming to Siteman Cancer Center who are going to see me, they should realize that their treatment process is not straightforward. It involves discussion. It is a shared decision between myself, the patient, and their families. To that end, it just doesn't only involve me. Sometimes it's multidisciplinary care, and so patients should feel reassured that they are getting all the strengths, all the resources of the Siteman Cancer Center to treat their disease. In addition, I'd love patients to realize that they can see me as a friend, as an advocate for them, as someone who's going to tell them what they should hear, not necessarily what they want to hear. It's sometimes tough, but it's my hope that with good communication and excellent resources, that we can give the patients their best possible opportunities for a good outcome. My mother was a nurse at Barnes-West County, and I saw the impact she had on patients. I also saw the amount of dedication that was needed to provide excellent patient care. She often took that home with her and shared some of the positive aspects as well as some of the challenges that she faced. Overall, though, I must say that it inspired me to go into medicine because I saw the impact that it had on her patients, and I saw the reward that she experienced when she had those good experiences. In addition, treating patients as family members betters not only the patient, but also the physician. Realizing that when that patient is waiting in the waiting room, their mind is racing. This is some of the toughest medical decisions they're ever gonna have to make. It's easy for me to stand outside the patient door and be very calm, but inside that patient room, there's often a terrified, a scared individual uncertain about the future. And so it's important to realize that human, that personal connection. I try and do that with all of my personal interactions, making sure that we don't treat patients just as study participants or the next surgical case, but really a loved one who's about to go for ongoing care. Telehealth is a big part of modern medicine. We know that patients often need to travel long distances to get the expert care at Siteman Cancer Center. They don't always need to have a physical exam or otherwise travel that distance. And oftentimes telemedicine or telehealth services can help bridge that geographic barrier, allowing the expertise of Siteman Center to extend beyond its physical borders and really to the greater community. I think it will have an increasingly important role as these technologies get better. We now have the ability to remotely monitor patients, not just provide counseling. And so I think that the role of digital medicine, remote medicine, telemedicine will only become more important. The field of robotics has revolutionized our surgical approaches. There are medical therapies, immune-based therapies, gene therapies, and chemotherapies that are making huge impacts in the survival of patients. When we have these common cancers, such as prostate cancer, we can generate lots of data. And with that data, we can use advanced computer technologies to really recommend or drive clinical care to make sure that each patient gets the best possible treatment. It's always nice to see a patient back after surgery, smiling, knowing that they are cancer-free, and appreciating the care. The most rewarding is really developing those relationships with the patient and their family. It's very rewarding to see the patient do well after surgery. It's equally as rewarding to see their family members happy and understand that their loved one is safe. There was one patient in particular which sticks in my mind, and this is a patient who had bladder cancer. It was in one part of his bladder, and he was told that he had to have his bladder removed. And he was a young man, very active, and he was deathly afraid of that. Ultimately, we were able to give him a combination of chemotherapy and a surgery that spared part of his bladder. And ultimately, we found that because of the combination of chemotherapy and surgery, he was disease-free. I remember calling him on the phone and telling him this result. Because of this, he was able to tell his family that he didn't have cancer. And it's now been 5 years. He calls me every June 27th, and he reminds me of this result. When you hit those home runs, it really sticks with you, and patients really appreciate that.